Good morning. Today is July 15th, and we're officially halfway through our short Minnesota summer. Wow, the time goes fast. We're still COVID-free with all our residents and clients, so thank you and keep up the good hygiene and distancing practices. It works. In the last several weeks, many businesses in many states have reopened after being closed for several months. It seemed to be okay at first, but then we've seen a literal catastrophe. Florida, Arizona, Texas, and other states have exploded with new COVID cases. This last Sunday, Florida had over 15,000 reported cases. How many are unreported, no one knows. And Monday, 2 days ago, they had another 12,000. That is the most in one day anywhere in the world since the virus was first detected. Anywhere in the world. 3 things have caused this. 1, not wearing masks. 2, not distancing, and 3, being in large groups indoors. I listened on the radio to a bar owner. She was crying after she was shut down now for a second time. She lamented, "We've done all the right things to keep people safe in our business, but our customers are not following guidelines, spreading the virus, thereby leading to our closure again." Some say we're in a second wave, but I and many others believe we're still in the first wave, with more to come for some time. This new wave of outbreaks has shifted the average age of those getting the disease. For the last few months, the average age of those contracting the virus was almost 50 years old. In the last 2 weeks, it has shifted to the 20s. Very young people in these gathering spots not heeding the warnings with disastrous results, with explosive outcomes. Up to now, most of the deaths have been in the elderly, people in their 60s, 70s, 80s, and 90s. Now we're seeing healthy young people die, and hospitals once again having their ICU, their intensive care units, at the max. Many states are now implementing mandatory quarantines on any travels coming into the states. Failing to report and quarantine for 14 days traveling to New York can now get you a $2,000 fine and possible jail time. How they're going to enforce it, who knows, but the point is, it's serious. Scientists are now determining the effects of this virus are varied and diverse, from asymptomatic, like my 97-year-old mother was, she's doing fine, to those becoming symptomatic and dying in a few days. They're also finding lasting, lingering negative effects to one's health after that person is determined to be COVID-free. And they're also saying many can catch the virus again. So getting it and getting over it does not mean it can't come back and kill you later. As I described above, healthy young people are now getting the virus and dying. The population we all serve are quite vulnerable. The CDC suggests there are 7 conditions that if one has one or more of these conditions, their health risks increase dramatically. They are, not in any particular order, priority. 1, your immune system is compromised. 2, you have COVID or an emphysema. 3, you've had an organ transplant. 4, you're obese. 5, one has kidney disease. 6 is sickle cell, and number 7 is type 2 diabetes, which I have. Think about this. Each resident we care for has perhaps one or more of these conditions. That's why keeping the virus out of our homes is critical. Yesterday late, I received an email from HUD, who guarantees some of our mortgages, that they were notified by the health department that we had the virus in one of our facilities and wanted to know how many residents were positive, how many deaths we've had, what our plans were, etc., etc. I explained in that location a staff member had tested positive and was not working in the facility until they're healthy again. No residents, no deaths. Third parties have a major impact on our lives. The governor and health department and others have legal powers that can dictate what we can and can't do and how we operate. So it's important we play by the ground rules. Now the Minnesota Department of Health is relaxing the no visitor rule to our facilities. They're allowing visitation outside following hygiene and distancing practices. We will comply with these directions, but we need to be very, very careful. My fear is a family member who perhaps has the virus wants to visit and they refuse to wear a mask. How do we handle that? They could spread the virus to someone living in one of our carefree livings, and like wildfire through the facility, residents and staff become infected. Just like the bar owner I described earlier who did everything right, but her customers spread the virus, leading to her being closed, out of business. Until when? No revenue, but bills to pay. The same could happen to one or more of our locations, an outbreak leading to possible closure and job loss. This sounds dramatic, but it's already happened in our state to a number of facilities. We as our company and extended family have been very fortunate thus far, and it hasn't come by accident. All of you have done an outstanding job being safe. Remember, we have personal protective equipment if you need it at work or away from work. So please ask and use it. Our business continues to struggle like all of healthcare as people want to avoid long-term care, clinics, hospitals for fear of catching the virus. But we are okay and we're going to make it. And like I said last time, we're paying all of our bills on time. So stay safe and God bless you and your family. Thank you.